Hello everyone, welcome to another episode of Fridays with Dhawale. I am Dr. Priyanka Kewalramani, Medical Officer at Department of Psychiatry in MLD-MHI Palghar. Today's topic of Fridays with Dhawale is management of stress from a homeopath's perspective. In the previous episode, we have seen management of stress in general. There are many causes of stress. Common causes of stress are discussed here at three levels: workplace, family place, and social place. So, at workplace, common causes of stress are workload, increased workload, unfair treatment, interpersonal conflicts with colleagues and friends, lack of acknowledgement, etc. At family place, there are also many causes of stress. Common causes of stress at family are financial stress, which is the biggest problem, illness of self or illness of others, traumatic events like death, separation of family members, etc. may be the causes of stress. At social place, addictions, loss of job, retirement, death and separation of friends again, and socio-economic discrimination. These are common causes of stress at social place. But how do people generally manage stress? People generally watch movies, they do meditation, or by just sleeping, going on vacation, by indulging in drugs and alcohol, or just by reading books. But how in homeopathy we understand stress? Let us see with a case example. This is the same case example which we have discussed in previous session. So this is a case of 25 years female patient who complained of polymenorrhea, 7 days of 15 days cycle. Cycles are painless with itching eruptions in groins, worse at beginning of menses. With this, she also complained of left-sided severe headache, which was worse for 2 to 3 times in a month, and it aggravates with sun exposure, light, noise, and better by heart pressure. Her investigations USG report was suggestive of bulky ovaries and with multiple tiny follicles. TSH was within normal limits. In history, we inquired that she worked as a quality control officer in pharmaceutical company and studies MSc in correspondence in chemistry subject. Let us see her case history in detail. So in family, she has 2 siblings, one is elder sister and one is younger brother. She has sibling jealousy, which is commonly seen in families, but with this sister, patient feels that she is the one who does all the household chores in house and no one supports her. Also, there are fights between the parents, so she feels lonely. All other family members take her elder sister's side and not her side, so she feels lonely again, though living in a joint family. There are criticizing comments of uncle and aunts, so she feels very lonely. With all this stress environment, she gets dreams of being murdered, dreams of ghosts, dreams of quarrels. So her family environment is very stressful. Similarly, at workplace, she feels unfair treatment with her, especially when boss shouts her or scolds her. Also, there is lack of acknowledgement for her work and lack of rewards. Her colleagues and friends, they do backbitching about patient and bully patient at workplace. So that workplace environment is also very stressful for patient. At social level, she has only 4 friends, but it is noticed that patient has pleasing behavior and she feels that she is the one who compromises when there are some arguments with friends. She is the one who compromises every time. How do homeopaths treat stress? This was a life space. In general, now we will see there are 3 types of 3 categories where we include remedial management, ancillary measures, and diet and lifestyle modification for treating stress. So first is remedial management, where we consider totality of all the symptoms that patient presented with and then we classify them. So this is the classification of symptoms. where first symptom is elements from discord between parents, which is an emotional causative symptom. Elements from discord between chief and subordinate, which is an emotional causative symptom again. Forsaken feeling is emotional mental general sensation. Delusion neglected is intellectual qualified mental sensation. Sensitive to criticism is emotional qualified mental sensation. Sensitive to external impression is physical qualified sensation. Being responsible is an emotional attribute. Dreams of quarrels, ghost and murder is a mental general symptom. Eruption before menses is a characteristic particular symptom. Left-sided headache worse in sun is also characteristic particular modality. With this classification of symptom, we find that Kent's approach is best suitable for this case. So in Kent's approach, we considered totality and classified symptoms in mental general symptoms, subconscious general symptoms and characteristic particular symptoms as discussed here. So first we see there are mental symptoms, then subconscious general symptoms, and then there are characteristic particular symptoms. When we repertorize these symptoms, this is the repertorial sheet. Natrum mur, magmure, pulsatilla, lachesis, sulfur are the emerging remedies. And we came to a remedy, magnesium muriaticum. Let's see what our literature of Matra Medica speaks about magmure. Magmure, magnesium has infantile dependence and forsaken theme, and muriaticum has a theme of betrayal of trust and faith. Magmure patient, he feels that he will be let down and disappointed by his friends. Constantly he has the delusion of being friendless. He will do a lot for others, but he always has the feeling that no matter what he does for others, he still have no friends. So there is a friendless state most commonly seen in magmure patient. Also, these patients are very sensitive to any kind of confrontations. It is not that they are very coward, but their vulnerability is very purely emotional sensitivity. They are pacifist, always trying to make peace. For example, in a house where there are constant fights between parents, the magmure patient will go and stop them and will suffer a lot. He wants peace. So these patients, they want others to be happy and satisfied. They may go to excessive length to bring this about. Application of magnesium muriatical literature in this case, we see that the patient has a strong sense of duty towards family. She feels unsupported and neglected from her own family. Her repressed desires and need of dependency is expressed in her vivid dreams of being murdered by sister, quarrels with sister, ghost, insults in office, and her pleasing behavior with friends. She is hypersensitive both mentally and physically. The affection of glands, menstrual abnormalities, neuralgic head pains led to the prescription of magmure. So the ancillary measures in general, they refer to healthcare services to supplement the process of healing. In this case, ancillary measures suitable were psychotherapies, where social and communication counseling with cognitive behavioral therapy was advised for building proper social support. Also, building adaptive coping strategies through CBT help to overcome the feeling of forsakenness and feeling of compromise in patient. Also, the diet and lifestyle modification was advised to her. Making healthy changes in diet and lifestyle habits help manage weight, balance hormonal changes, and improve general health. Physical exercise and yoga was also advised, especially brisk walking to maintain weight and yoga asanas for hormonal imbalance. So we have seen that in this case how a homeopath manages stress with respect to totality of symptoms. Now let us see how in our repertories common symptoms of stress are represented. At workplace, when we repertorize the symptoms of stress, like unemployment is a cause of stress, loss of job is a cause of stress, insecurity at workplace is a cause of stress, we see rubrics commonly in our repertories like elements from job having lost his, elements from anxiety, elements from anticipation, fear poverty of, fear starving of, unfair treatment, elements from jealousy, elements from indignation, elements from embarrassment, elements from discord and disappointments. When there is loss in business, failures, poor job performance, elements from ambition deceived, anxiety business about, fear failure, fear of business failure of. When there is increased job demand and increased workload, then rubric may be elements from mental exertion. When we repertorize all these symptoms, the common remedies that come up for stress at workplace are nux vomica, ignitia, natrum mur, staphylos aureus, sulfur and phosphoric acid. At social place, symptoms like social position, honor, reputation, isolation, socioeconomic discrimination. Rubrics for these symptoms are elements from reputation loss of, elements from honor wounded, elements from domination, fear social position of, despair social position about his. So common remedies for stress at social place are staphylos aureus, veratrum album, sulfur, hemimylase, lycopodium, carcinosin, etc. At family place, common symptoms are family financial problem. When we repertorize this, we see anxiety, money matters about. Also there is common symptom of illness of self and family members. So we can take rubric like elements from cares and worries, anxiety, health of self and relatives, fear, disease of impending, fear happens something family to his. When there are family conflicts and that is the cause of stress, so elements from anger, family towards suppressed anger, elements from disappointment and discords, aversion family towards his, quarrelsome family with his. So these are common symptoms and its rubric. So here in this PPT we saw stress management from a homeopath's perspective, its matra medica application, its repertorial management, its repertorial representation and the common remedies which are included in stress. Thank you.